Hello, everybody. Greetings, citizens of this big, weird, wild, and wonderful world in which we live. And thank you for joining us for yet another University of Guelph Department of Physics live stream. I, as always, am your humble science communicator, the Great Orbax, and I'm here located in Physics Hollywood as we prepare for yet another one of our streams. Just wanted to thank everybody who tuned in last 2 weeks ago, I suppose, for the Martian landing. It was a pretty exciting and amazing time. And so we are really hoping that we can continue these as much as we possibly can and bring as much excitement and scientific enjoyment to as many people as we can. Now, if I take a look here, we got some pretty incredible guests tonight that are already, let's see, we got some comments already coming in. We've got people already pretty excited about this entire thing. So I guess we might as well get to it. Well, medical physics is the topic of tonight's discussion that we'll be presenting. It's come a long way, medical physics, since its inception in the late 1800s when Wilhelm Conrad Röntgen took the first radiographs of his wife's hand, which his study of X-rays actually led to the first Nobel Prize in Physics in 1901. And since then, scientists and physicists have been using a variety of ways to image the human body for medicine. Ultrasound, magnetic resonance, computed tomography, nuclear medicine, X-rays, radiation therapy, all of these are branches of what we call medical physics, which often has physicists working hand in hand with highly trained medical doctors, engineers, and radiologists. And tonight, we're lucky enough to have two panelists who are joining us who are actually both Guelph Physics alumni. First off, we have Dr. Alexandra Rink. Dr. Rink completed her BSc in chemical physics here at the University of Guelph in 2002, but her convocation didn't take place until 2003. So she split between 2002 and 2003. She's since gone on to become a lead brachytherapy physicist at the Princess Margaret Cancer Center in Toronto, and we welcome her into our stream. Hello, Dr. Rink.
Hi, thanks for having me.
No problem. How are you doing this evening?
I'm doing very well, thank you.
Very good. And we're going to bring in your co-panelists tonight. Next, we have Piotr Dubrowski. Piotr originally wanted to be a vet, but quickly made the correct decision to switch over and drop out of that and get into physics, graduating in 2005 with an undergraduate degree in biophysics. And he has since gone on to become a lead physicist at the Stanford Cancer Center in South Bay and San Jose, California. Hello, Piotr. Are you there?
Hello, guys. Thank you for having me.
No problem. And how are things down in San Jose? We're jealous, stuck up here in this Canadian winter right now.
It's warmer, yes.
Slightly warmer. Well, I'm pretty excited to get into this topic of medical physics. Now, you've both done degrees here at Guelph, and we have a biophysics program that's pretty hardy. And we have a lot of young students, undergraduates, and even some graduate students who are looking forward to different careers in what physics has to bring. So one of the questions that I wanted to ask, and I wanted to ask each one of you in turn, I'll start with you, Alexandra, is what is the most exciting thing about medical physics to you?
So for me, I think the most exciting thing about medical physics is being able to take the field that you are passionate about, so physics in this case, and to actually apply it to solve various problems in healthcare, to improve the quality of life of the patients that we treat. And I think that in itself is exciting.
Absolutely. Piotr, same question to you. What do you find to be the most exciting element of medical physics?
Yeah, like you mentioned, I came with the idea of sort of veterinary college and kind of that stream. So the healthcare aspect is really, really important to me. It's very rewarding to see, something that you do today can literally impact a patient the next day. It's really, really an interesting dynamic that way. And also, I think for me, something on like just a job career level, no day is the same. One day to the next is completely different. And so that routine, there's some routine things like I will mention, but in reality, every day is a different problem that you get to solve and test and play. And so it really keeps things really, really dynamic and interesting.
Well, I think it's sometimes difficult. We mention this often in our streams. It's sometimes difficult for our undergraduates who are swamped with work and always cramming numbers, working on equations and calculations to kind of see the end point of where they might go with their careers. And from what I know, and I'm about to learn so much more with medical physics, is exactly that. You not only have the elements that Alexandra was talking about, where you have this personal interaction where you're working with physicians and you're actually doing something that impacts healthcare, but you also have this opportunity to sort of play and to learn and to keep reinventing techniques and true experimental setups.
Correct.
Yeah. So, I mean, I am personally excited to learn more about this. And from what I know, you've prepared a little bit of a presentation that you can show us exactly what medical physics is and how we can apply it to our lives.
Should I start?
Without any further ado, take it away.
Okay.
Wait, it's on the
All
wrong
right.
side. Hold on. Without any further ado,
Perfect.
take it. Oh, I went the wrong way. Take it away.
Okay. So can you guys, is it up? The screen? So today we'll be talking about becoming a medical physicist and how you basically move from a graduate degree to actually participating in the clinic. So I'll start with discussion of scope of practice, and then Piotr is going to actually give examples of what, you know, a day in the life of a medical physicist could potentially look like. And then we'll finish off with, you know, what are the steps that one would need to take in order to become a medical physicist and practice in either Canada or United States. So the scope of practice is defined by Canadian Organization of Medical Physicists, or APM. Basically, medical physicists are, in fact, healthcare professionals, and we specialize in medical application of physics. So our biggest component is actually around safe use of X-rays, radioactive material, ultrasound, magnetic and electric fields, radio frequency waves, and so on. Further, there's a definition of something called a qualified medical physicist, who is defined as somebody who works collaboratively with physicians, medical engineers, technologists, therapists. And again, it's to ensure that all radiation producing and related equipment remains safe and suitably calibrated, that radiation dose determination are accurate, and imaging modalities are functioning at their optimal level. So our biggest responsibility is to patient safety and welfare and to the staff and the public. So qualified medical physicist is typically somebody who has a master's or a PhD in any of the following fields. So physics, medical physics, biophysics, radiological physics, medical health physics, or equivalent from accredited college and university. And there is certification in very specific subfields that somebody could obtain from an appropriate national body. And I will cover those on the next slide. COMP further goes to specify that a qualified medical physicist is actually an individual who is competent to independently provide clinical professional services. That means somebody who can work by themselves without supervision in any of the subfields of the medical physics. So the subfields that I've mentioned, there's actually a couple, not a couple, sorry, 5. Therapeutic or radiation oncology, something called diagnostic radiology, there's nuclear medicine, there's something called medical health, and magnetic resonance imaging, or MRI. And depending on which one you're getting, whether you're getting certified as your first certification or you're getting recertified, there are various bodies that can do that. So American Board of Radiology and Canadian College of Physicists in Medicine are the ones responsible for probably majority of the medical physics certifications across US and Canada. And I think at this point, I will give it to Piotr. Hello?
There we go. Hi, I was muted, sorry. Yeah, so I'm going to give you guys a little bit of an idea of what the day in the life of a physicist looks like. And this is our flavor of radiation oncology physics. And even between Alexandra and I, there's a little bit of a difference. I'm an external beam physicist. She's a brachyphysicist. It's very kind of small, minutia of details, but our lives are a little bit different. So this is kind of one slice of the pie, but I think it's the most common slice that you'll see. So like as I mentioned in the introduction, one of the reasons why I love this job is that there is no routine, but that's like kind of a lie. There is actually some routine tasks that we're always responsible for the clinic. So again, we work in a dynamic healthcare environment with doctors, dosimetrists, therapists, and nursing. And our role in that is basically when a cancer patient comes for treatment, We will either plan that treatment in a computer in order to deliver it effectively, or we will actually check the plan before it reaches the patient. Effectively, this is basically us ensuring that whatever the plan is, however the plan is designed, whatever the calculations that were done in order to ensure that the amount of dose that goes to the patient is correct, we have to make sure that the machine can deliver that and anything in between that chain. And likewise, we actually also QA or check the machines in order to make sure that they are delivering the radiation that we think they're delivering. So that involves lots of daily, monthly, annual QA checks, as well as performing machine service or checking machine service when it was done to make sure that the machine is still functioning as it was supposed to do. So that involves a large variety of QA tools and data analysis, right? So if you like tools and gadgets, this is a great job because you get to play with lots of different very high tech toys. So in there's other peripheral roles that we play. So that we play a supervisory role. So during high dose treatments, these kind of high risk treatments that we're performing, or brachytherapy treatments, which are treatments that are kind of a little bit more complicated. You are usually there. In the US, we have to be present, and we kind of sign off an attestation that we are there. We do verification checks for patients. For like each week, we'll go over their chart with the doctor and make sure that everything's kind of up to date and is going properly. And then we have these consultation roles where we'll evaluate, for example, if somebody has a pacemaker, or if a patient is pregnant and she's going to get radiation therapy, we have to evaluate the dose of the fetus or the dose of the pacemaker. And we perform these sort of side peripheral tasks in order to kind of make the healthcare sort of system work properly. And in the US, as this presentation goes, I'm going to try and kind of show you guys some differences. So in the US, these are all billable things that we do. So each one comes with a very boring document that I have to fill out and sign. But like I said at the beginning, variety is the spice of life for this job. And it's one of the highlights because every day is very different. So one of the biggest things that we play, one of the biggest roles that we play is equipment selection and pushing the technology. So for example, as new machines are developed and new technologies developed, it is our job as a physics group is to basically evaluate that device, make sure it's going to do what it's going to do, what the vendor says it does, and basically put it through its paces in order to make sure that it's safe. So right now at Stanford here, we're putting in 2 new machines. So on the left here, it's called the Reflection X1. It's the world's first PET-guided, so PET is positron emission tomography. So it's the first PET-guided radiation therapy machine. And on the left is an MR Linac. It's new to us, but they've existed for a little bit. And with the reflection, as you can probably tell, any first of anything goes terribly wrong. So we're way behind schedule and it's not going very well. But the idea is that new technology comes, and it is the physics role to really evaluate it to make sure that it's going to do what it says, what it's designed to do. Like Alexandra mentioned, radiation safety is really important, and it's really the primary goal of any medical physicist is the safety not only of the patient, but also of the staff that's working there and of the public that's around there. And so that it involves a lot of shielding, design, and evaluation, incidents reporting. If things happen, we have to report out to the state or to the government of Canada. We often play the role as a radiation safety officer wherever we work. And again, a kind of a US-centric perspective of this is the US, working in Canada for about 6 years and coming here for since, the US has a lot of small clinics, whereas Canada is very centralized. So what the interesting thing about that is the network expansion here in the US you're constantly growing. The clinics are changing hands. It's this kind of weird business world. But as a result, we often, when I first started, there was only the little green clinic here in Palo Alto. And very quickly, we acquired 3 other clinics in the region. And each time we acquire one, we have to go in and evaluate what the different protocols are. We have to make sure that everybody's doing everything safely. We'll often change out the machines, so you have to redesign the rooms and things like that. So it's a very dynamic job here in that aspect. One of the biggest things too is technique development and validation. So often what you're doing is you're implementing new commercial technology. So it's not necessarily a new machine, but some new piece of hardware that gets added to a machine in order to improve patients' treatments. Or you're taking current technology that you already have and you're finding new ways to do that. So for example, actually, I guess we never talked about this, but these are images of a linear accelerator. So they deliver external beam radiation, so radiation from a machine basically, in order to treat patients. And they do it kind of in an arc fashion mostly. So, basically you can add on different technologies to this to improve patients' treatment. So we currently have surface guidance. So it's a 3D camera that can basically position the patient. HyperArc, these are some silly details, but the idea is that you're always looking for ways to improve the treatments with either new technology or finding new uses in your current technology. And I think Alexandra actually said this, but a lot of the time we're problem solvers, and I think this could be more true. So there's a two examples. So that just happened to me in the last month. So we have a PET scanner that we use to scan patients in order to treat, in order to develop our treatment plan. Okay, so you need a CT scan first. Well, our treatment planning, or our CT scan, or our PET CT, is being removed, and so we're using this kind of older one that actually has a limited field of view. So when we scan a patient, we don't get the full, full body. Often we'll have to lop off a side of the patient. Well, you can't really plan a treatment because you're missing part of the patient's tissue. So we said, okay, well, we ran to the local hardware or computer store. We got a little 3D camera, and we just came up with a way to actually scan the patient's 3D body, fuse it into our computer system, and basically reconstruct that missing tissue that the scanner is missing. Another example is often when you are creating, when you're treating with electrons, you can treat both with photons and with electrons. When we're treating with electrons, they're kind of more crude and more basic. So you can actually, what you'll do is you'll design like a lead cutout. And this is literally, some molten, it's called Cereband, it's like a lead analog. It's got lead and cadmium, some other nasty chemicals in there, or metals. And so you will literally pour molten lead into this shape. Well, we were told that we have to stop that because it's too hazardous. So we said, okay, well, how can we solve that? And we decided, well, we have a 3D printer in the department, so why don't we just 3D print these things, fill them with BBs, tungsten BBs, and basically switch to using that instead. And so as a kind of an external thing, a little more, again, about how important the job is in terms of how many opportunities there are, we actually also go out to kind of perform some global health work and outreach programs. And it's really, really rewarding. And we get to go to Kenya and Tanzania and a couple of the places, either remotely or before COVID, we actually went to the places and kind of try and modernize the technology as we move forward. So there's lots of opportunities, both in the clinic and outside. And yes, we do get to go on a safari. It was amazing. So a couple of beneficial skills for a physicist. So like Alexandra said, it's an integrated profession. So you are part of this healthcare team, and you really, on a day-to-day basis, are interacting with many different people. So you obviously have to be very comfortable with data and analytical skills and methods, but really you're doing a lot of education, a lot of workflow design, and a lot of sort of planning, high-level strategic planning with your coworkers. So a lot of soft skills are really beneficial. So you don't have to really just be good with data and analysis part. You have to know how to speak with the doctors, the nurses, the therapists, and everybody in between. And really, you have to be able to wear different hats throughout the day. I mean, you can go from solving an IT issue on the treatment machine to working with a project manager about a new install and I literally had to be a plumber a couple of days ago when we sprung a leak in our cooling system. So it's really a very dynamic job. Lots of different opportunities for people, and I really love it. And I think I'll go back to Alexandra.
Thank you. So again, in terms of describing the different opportunities, definitely one of the other things that is a big component for many medical physicists is the teaching and research that comes with the job. And depending on which institution you wind up in, if it's affiliated with a university, there's obvious opportunities to become assistant professors and moving through academic ranks as well, and to do research. So, for example, I have appointments in both radiation oncology and in the medical biophysics department at University of Toronto, and I have a lab at the Techna Institute across the street. So while 50% clinical and while leading and supervising a small clinical team in brachytherapy, I do in fact also do teaching and research as well as part of my job. And then of course there's opportunities to get involved at more of a administration, guidance, and policy setting levels. So for example, again, both Piotr and I lead clinical groups, but you could be, a site group lead. So, for example, leading the group specializing in like breast treatments or gynecological treatments. You can participate in design of curriculum for clinical training. There's opportunities to get involved and, chair or participate in internal committees that create policies and procedures internally. There's opportunities to get involved externally. For example, I'm a member of the Ontario Health Community of Practice for Gynecological Cancers. So, we review how, for example, patients are treated and set guidance around that. And of course, there's also opportunities to get involved with bodies like the American Association of Physicists in Medicine or the Canadian Organization of Medical Physicists and participate in different task groups as well. So your career or your job as a medical physicist to some extent is whatever it is that you actually shape it to be. And there's definitely many different things that a person can do to make it fulfilling. So let's say you guys are actually interested in this. So to actually to answer what it is that one has to, what steps one has to go through in order to become a medical physicist. So typically, as I've mentioned before, medical physicists are either have a master's or a PhD in a related field. A graduate degree from a CAMPIP accredited program is highly recommended. Or if somebody did a PhD in a non-CAMPIP accredited program, there are actually certificate programs that can be taken. They're basically 1 year of didactic courses that will make up all of the courses that a CAMPIP program would have exposed you to. And then afterwards, again, highly recommended to go to a CAMPIP accredited residency. And while a CAMPIP accredited residency is not mandatory to do your exams with the Canadian College of Physicists in Medicine in Canada, it is mandatory to do your exams through the ABR in the United States. And the caveat here is that a lot of the residencies typically actually want CAMPIP graduate degrees. There's obviously some exceptions to the rule, but these exceptions typically are applicable to people with PhDs. So exceptions would be Harvard, for example, has a 3-year program where all of the CAMPIP courses are repeated regardless of your background. The other exception, again, you can take courses through something like inter-university agreement. For example, somebody from University of Toronto can actually take courses through Ryerson, and basically then you show that you have taken or sat in on equivalent courses. But it's a bit risky to do this because it is up to the applicant to prove equivalency to the director of the program. And again, these exceptions are typically only for people that have a PhD. If a person has a master's, it needs to be from a CAMPIP accredited program. So if anybody is interested in this or wants to evaluate their path, we do have both Dr. McNiven and Dr. Christoph's email addresses here, and you can feel free to reach out to these directors to get a more thorough assessment of your particular situation. And on that, I'm going to wrap up, and hopefully we can answer your questions, guys.
Excellent, very exciting. Well, this is quite an open conversation about where to take your physics career and how it can actually do more than just be looking at numbers or watching a computer index roll through. It's exciting to me, this cross-disciplinary ideas that come across that both of you are talking about. And I've got to ask, this really struck me when Piotr was talking, as somebody who tries to do communication across a large amount of people who have varying amounts of technical knowledge. What is it like as a physicist trying to chat with a nurse, trying to talk with an engineer, trying to be able to talk with a medical doctor? Do you find that you really have to shift into a different mindset? Is communication really become a primary importance? I found I didn't realize communication would be as important when I was doing my undergraduate degrees or even graduate degrees. It wasn't until you get out there that you realize it's such a huge thing.
Yeah, honestly, I think that's one of the, like I mentioned, I think it's one of those beneficial skills for a physicist is to be able to communicate your ideas and really communicate either the problem or the solution to whoever you're working with, right? Often, you have your own understanding of the problem, but you have to get buy-in from several groups in order to change things. And so being able to have that conversation at whatever level they appreciate you, and whatever level is also necessary, right? Often you have to get quite technical. But I think, yeah, having the ability to really switch hats and switch gears and really either dump things down or try and, move things over to a different perspective, I think is a huge, huge benefit for this field. And it really benefits, everybody, including the patients and the clinic as a whole, to do that.
Alexandra, do you have anything to add?
No, I definitely agree that communication skills are incredibly important, and understanding the different perspectives when you work in such an interdisciplinary environment is also very critical. Again, for the benefit of the patients, of course, but also to have a rewarding environment in which you work in, for sure. So I don't have much to add to that. The other component of communication, of course, is in not necessarily oral communication, which you've just addressed, but I think writing skills is also very critical, especially if you, as a medical physicist, are trying to have an academic career. So in terms of publishing and in terms of applying for funding, being able to communicate your idea and sell it and make it exciting and have somebody give you lots of money to pursue it, it's very critical to be able to actually write it down in a way that somebody can follow and buy into it. So writing skills, writing communication skills is also really, really important.
Did you find that was something you actively had to work on, coming strictly from academia, that writing skills, of being able to get this communication down, that these were things that you actively had to take control of? Or did they just kind of come along with the job and you eventually sort of, it just came up by itself?
No, I think I very early on understood that to be able to have a successful academic career, writing is a critical skill. So I deliberately went out of my way to improve my writing. So oftentimes universities will have courses where, you can show up with, a few paragraphs and kind of dissect it. And there are specific scientific writing classes that I at least encourage my student to take. So no, I worked at it. And writing is hard.
Yeah,
it is. I'll agree. But I think on the clinical side, I think sort of what you mentioned, it naturally evolves, right? I mean, you are embedded in a healthcare team and you slowly learn the lingo and you slowly learn people's roles, and
it's like
it evolves into that.
The language of learning how to speak and communicate. And I guess too, with so many people working in an environment like you do across multidisciplines, everybody's sort of just osmotically absorbing people's lingo and catchphrases from different groups of science.
Yeah, definitely.
Yeah, I was gonna say there's a running gag that sometimes when two people are speaking, half our conversation's acronyms, and if you were a fly on the wall, you have no idea what anyone's saying because it's just jargon and lingo. And I think being kind of aware of that and being really just giving yourself the opportunity to absorb as much of that as possible and not be kind of scared to ask, hey, what does that mean and what does that mean? I think it benefits you quite a bit in this job. Exciting.
Well, speaking of acronyms, we've got PET, we've got MRI, we've got these X-rays, whatever they are. So my understanding of what medical physics is that please inform me if I'm wrong, but it breaks down into basically two elements, and one is treatment and the other is diagnostics or imaging. Is the use of specifically different particles or rays, do they go hand in hand with those two different elements of it? Or do you find crossover across both of those with the different types of techniques that you use and the different types of equipment you work with?
Yeah, I think, at least for me, yeah, definitely there's a lot of crossover. For example, there's diagnostic physicists, right? So they would mostly be using, basically taking care of CT machines, for example, as a very broad example, or fluoros. Whereas our treatment machines have basically CTs attached to them, right? These cone beam CTs. And so often we'll be doing the same kind of testing to make sure our image quality is the same. And these are the same tests that a diagnostic physicist would be doing. It's just this routine specialty that we are kind of embed ourselves. That's sort of the divergent part. The the one thing I wouldn't trust myself to, to do certain things for an MR versus, I'm sure the MR physicist wouldn't trust himself doing them for an external beam physicist. But there's a lot of overlap, and there's a lot of really nice communication that goes along with it. If you have a group that has, diagnostic physicists or MR physicists there's a lot of really neat projects and really neat crossover that you can get from them.
Well, can you explain to me how X-rays are used in the treatment of cancer? Right from the bottom up. Let's lay this right out. How do we? So for an undergraduate who has basically no knowledge of how they're going to be taking the things that they're learning in, say, even first year, in terms of attenuation, in terms of how these particles go into a body, how do we actually deal with radiation and biophysics?
Sorry. So basically, you start off with an X-ray beam interacting. So if you're treating the patient, X-ray beam is interacting with the patient. And you will, during the interactions, you will have basically knock-on electrons that will then propagate through the patient. And as these electrons slow down in the patient, they actually release the energy and ionize the water or the particles around them. And it's that released or absorbed ionizing radiation energy, which is the dose, that actually then contributes to DNA damage. And that's kind of like the very, very nuts and bolts basics of how that happens. So the higher the energy beam, the greater penetration, for example. So if you have something like an orthovoltage beam, you're typically treating very close to the patient's surface. If you have a high energy, like a 6 MeV or an 18 MeV beam from a linear accelerator, you're treating deeper in the patient. And basically, where the technology aspect then comes into this is that you can modulate how you're doing this, right? So in the olden days, you would have basically a really square beam effectively hitting the patient either from one side or from both sides, parallel opposed beams. But now, as Piotr was describing, we can have intensity modulated radiation therapy, which, the beam will come from many directions and try to actually deliver something that's very conformal to the target, or we can have something called VMAT, volumetric modulated arc therapy. And that's basically where the actual progress in the invention in medical physics in recent years has come along, but the basics of dose deposition has not changed.
Well, it's interesting because my only base knowledge of this is from teaching Phys 1070 here and Phys 1130, where we talk a bit about ionizing radiation, and it's a lot about that. The dose, how much of the radiation you actually absorb, where it's absorbed, and to what organs. And so much of it seems to have to do with targeting and depositing energy at different levels. Have you noticed that with the explosion of even our ability to communicate across the world, the information we're able to transmit faster than ever, are you noticing rapid changes and permutations in the way that we treat these things, in the way that we're getting more and more accurate? Or are we kind of in the same slow march towards evolving our equipment that we've been having for the last 25 years?
That's an excellent question. I don't know that I've been long enough in the field to truly, tell you if it's faster recently compared to before.
I'm just curious. I mean, I don't need to derail it all, but I find with this, so much more the increase our ability of technology has let us achieve so much more quickly. I wondered if it was really taking shape in the medical physics world as well, that we're seeing that even just things in terms of scanning and imaging.
Well, I mean,
yeah.
sorry, did you want to take it? I was just going to say, I think the big component here is just in terms of acquiring data, pushing data, processing data. So that in itself has definitely significantly improved what it is that we're able to do. So, I mean, but is that? I guess that's quite reasonably has been the driving force for many innovations, because we can do now something called MR adaptive radiation therapy, where on a given day you keep taking MRs and based changing your initial plan with just a little bit of anatomical changes that you're seeing on the patient on that particular day, for example, on the MRL, and that just the amount of data and the speed with which you are able to do this and generate a new plan and process all of this obviously would not have been possible 20 years ago even. So, I mean, that's definitely a contributing factor. I don't know if Piotr, you want to add anything to that?
Yeah, no, I totally agree. The basic physics obviously hasn't changed for a long time, but I think there's these like paradigm shifts that happen as technology gets embedded into clinic.
Sure.
So, in the old days, like Alexandra said, it was big fields. You had a tumor somewhere, you had no idea where the tumor was. The doctor would draw a giant field and we would shoot radiation there. And we would exploit the fact that normal tissues repair faster than the tumor. And so you would fractionate, you would give these treatments over, 5 weeks, and the dose in the tumor would accumulate and the tumor would die, whereas normal tissues wouldn't suffer that same damage. Now we've introduced several technologies that can really shape the dose and really target the dose, and we know exactly where the tumor is from better imaging and better diagnostics. And now we're moving away from this large field, lots of fractions, to we're treating as small and as tight around that around that tumor or target, and we're trying to shove that dose in as quickly as we can. So that's sort of where the field is moving. And I think the end of that is Stanford does. I mean, there's several researchers working on this with these flash technologies. It's incredible, right? So a flash treatment is pumping dose that you would take for weeks, and you're delivering it in split seconds. And it's it opens up this entire world of new biology that we don't it's kind of the frontier to figure out why things are happening the way they are. But on paper, it's looking very, very promising. So I think there might be, on top of all the AI and computer processing and the speed at which we can do everything, I think the technology might also be changed such that we can deliver things and exploit new frontiers on that aspect as well.
That's exciting. Well, speaking to that, we had a question in the chat that came up pretty early on, and so we might as well address it right now. This was, it came on early on, and you just spoke a little bit to this, Piotr, which was this idea of we could touch on the importance of AI and machine learning in imaging in the field of theranostics.
I can just start off, Alexandra,
Sure.
you can add on. For sure, it's changing our field. Basically, the way that it works right now is that you get a CT scan of a patient. There's a person that will sit there and contour out individual organs within the patient. And then it goes to a physicist or somebody else to design the treatment plan, and then it goes off to the treatment, and that can take a week. Honestly, for very difficult cases, that can be a week of connecting with the doctor to the various people. With AI, you can basically reduce that whole chain to an hour, let's say, or sometimes mere minutes, which can happen on treatment. So you basically have a patient who gets scanned right as they are sitting on the table, and an AI can process all the contours, all the organs, adjust the plan as needed, and deliver a brand new plan. What used to take a week can now take 15 minutes, right? So I think it's becoming, both on the delivery side as well as on the diagnostic side, we're getting much better at finding things and using AI processing in order to basically determine what kind of treatment you should get and what kind of diagnosis you have. So I really think, if I were starting over again, I think computer science, especially with the AI kind of mindset, would be hugely beneficial to me right now. I'm doing a lot of YouTube tutorials right now to get to kind of catch up.
Right.
Yeah, there's definitely a lot of interest in how AI can help basically the workflow and what it is that we do. So this speed, again, is a huge component here. That said, a little bit of a worry that can AI take over, actually this has come up in several settings, can AI take over a medical physicist position, for example, or an oncologist position? Like if oncologist no longer needs to contour, if a physicist no longer needs to check a plan, then what is the point, frankly, of our jobs? But the reality of it is that there's still quite a lot that human beings are able to do that a machine cannot. And so when I look at the role of AI in at least medical physics, I look at it as more of an assistance rather than replacement. And same thing for contouring. Nobody, I don't know that we would ever take, for example, contours that are purely AI based and not even bother checking. So again, assistance rather than replacement of human beings.
Interesting. We have another question popping up, and this is actually probably syncs well with our upcoming roving reporter who will be with us in just a mere moment. This one actually, well, let's bring in Mel now as well. We'll bring in our roving reporter, our student on the ground, apparently deep underground. I'd like to welcome Mel to the stream, everybody. How's it going tonight, Mel?
It's good. Reporting from my cave.
It seems like it. I've got the real gamut of locations here. I've got my ethereal studio here in Physics Hollywood. You're deep in some cave. We're in San Jose and in an office in Toronto. We're right across the world. But this is a question that's coming in the chat. And as our viewers know, Mel's an undergrad here at the University of Guelph, the Department of Physics. And this is from a student who's a first-year undergrad at Guelph and was wondering in the area of medical physics and biophysics, what type of degrees do most careers require? I mean, the two of you are now pretty far along in your careers where you could probably give some pretty unique insight into what helps somebody move along in this path. And what can we offer?
I guess I'm trying to clarify what is meant by degree type.
Well, I think basically it's a student in first year who wants to know what they could take that would help them later if they wanted to pursue medical physics or biophysics.
So, I mean, any of the masters or PhDs in the fields that I have listed in the presentation are actually good. And we've had people that have, I mean, I had a chemical physics, undergrad and a biophysics PhD. So, I mean, as long as it's a related field, it ultimately, I don't think matters terribly much. What is obviously important is developing all the skills that Piotr has described and making sure that you have appropriate level of a degree, if it's a master's, camp up, accredited, and so on, in order to continue on.
I guess maybe to clarify something like that.
Yeah.
Do you necessarily need to go all the way through a PhD and a doctorate, or can you get these accreditations that give you an equivalency?
So as I mentioned at the end, if you do a master's, and so first let me just preface this with the fact that the rules have been changing over the last decade, actually. So when I did my residency, camp up residency, I actually entered it without having a camp up without a PhD from a camp up program. And I'm not sure what Piotr's situation was, but the rules have changed since I've done my residency. So now camp up accreditation, although not mandatory, and some programs will still take residents without it. They're rare. They're definitely less more rare than those that actually require camp up accreditation. And then that 1 year program that I have mentioned is really only available to people that actually have achieved a PhD. So if a master's is all somebody wants, but they are absolutely definitely interested in this as a career, then I would strongly recommend a camp up accredited program for their master's. And even with a PhD, I don't know that it's necessarily a requirement to become a medical physicist. It definitely helps if you want to have a split in your career where you are doing both clinical and academia.
Yeah, as a master's level physicist, I'll say I think I'm as a unicorn at this point. I think credential creep has definitely taken. And we are in a minority, and there's definitely a lot of barriers that as a master's physicist you face.
Yeah.
And it's not necessarily in the academic setting, because obviously we kind of knew that we signed up for that, but just in leadership and in physics. A physicist at a at a cancer center, for example, you play a leadership role whether you like it or not, because you're involved in all these decisions and all these high level projects. And it's just become a little bit more. I think it's just become more difficult for a master's level physicist to kind of make these kind of leaps. That said, in the US, I think the market is a lot different. There's a ton of smaller clinics all over the place. They're very fractured. The healthcare here is just a gong show. But as a result, there's a lot more opportunity for a master's level physicist to kind of, find positions and find jobs. So I think in Canada, at least when I left 6 years ago, I kind of saw that there was a lot of barrier to entry for master's level physicists behind me. So yeah.
It's interesting. It's always something that you don't necessarily think about when you're pursuing your studies, that you could still be doing, say in this case, medical physics, but in terms of career options, you don't want to close any doors as well, right? So I think it's pretty insightful to get advice like this to actually say, okay, what are the steps? What do we need to do? Mel, as an undergraduate student, somebody who's looking at potentially pursuing a career in physics, what questions would you have for our panel tonight?
I think maybe going off of what Elizabeth there asked. So, like for me, for example, I'm in my last year in physics, in an undergraduate in physics, and since it was just physics, I haven't taken any medical physics specific courses. And so what kind of gaps do I have, or what would I need to fill? What skills would I need if this is a career that I'm looking for? So I know you talked about communication and writing. Do I need to know more biology, more computer programming? Kind of what gaps do I need to fill for myself?
So I want to say that there isn't a one set of skills that fits all. We are, if you take a cross section of any department, you will find that the background and the skill sets we all bring to the table are highly, highly variable. I don't program. I don't pretend to program. But and others do. It really, I would say you pursue what it is that interests you, and whatever gaps there are, you can find and make up for it. Or, again, we're highly variable in our training and our background. Anatomy is definitely an important component, but anatomy is also something that you often wind up taking. If you wind up in a medical physics type of graduate program, that is often, for example, covered, or radiobiology is often covered, and courses like that. So if you're an undergrad and this is something you want to pursue, if you wind up in an appropriate graduate degree, chances are you're going to cover a lot of the bases that are required anyway. So I wouldn't necessarily stress too much about that.
Okay.
I would just add that when I came in, I was kind of like you. I started off in a different, completely different stream. And even in my master's, my research was in like microscopy and optics. And so I think there's a lot of opportunity, like Alexandra said, to catch up. If you take a Camp-Up accredited course, whether you like it or not, you're going to take that anatomy course. So you're going to take, these introductory to radiation physics and MR and all that stuff. So there's a lot of that you can do to catch up. But that said, I think the field is moving towards, computational physics is there, and sort of that comfort with coding or comfort with computers, at least, or computer science concepts. So I think that would be beneficial. I think that's definitely something that I regret not pursuing more, because I actually love it. Give me some computer program to mock up, and I'll spend days doing it. I didn't realize I enjoyed it so much.
Well, Piotr, you have definitely more of a circuitous sort of path to getting to medical physics. At what point in your career did you decide this is what I want to do? Medical physics is where I want to go.
So actually, after I finished Guelph, or around when I was finishing Guelph, I was working at John Dutcher's lab with you and Chris Schultz-Nielsen, and just having, I worked on these like bacterial biofilms. So I was over in the microbiology lab, we were spitting down bacteria into little pellets and like sticking them. I realized, I was talking to this microbiologist, and I realized like I really enjoy. I'm one of these people who, jack of all trades, master of none. I really enjoy kind of feeling out and really learning about everybody else's work.
Yeah,
and
absolutely.
And then I kind of come across medical physics and had a friend who applied to University of British Columbia, where I went, and it was just kind of natural from there to progress into that, where it was something different and something more involving a lot of different people, a lot of different groups, and give you that exposure to everybody else's career. And I really enjoyed that. I kind of pursued it at that point.
Yeah, I think it's pretty easy when you're in an undergrad and even throughout your entire master's to just have kind of your nose to the grindstone, your head is down, and you're focused so much on the individual bit of physics that you're doing that you're not really open to this whole world of science that's out there that got you excited about getting into science in the first place. Alexandra, when did you know? You seem to have much more of a direct path towards medical physics.
I don't know how direct it is. I find that a lot of, young people in undergrad nowadays have a lot more of a plan than I
Young
do.
kids these days, and they're too whatever.
Look at them all in this stream.
No, it's true. People often already have a career path kind of, planned out when they're in second year of undergrad. I didn't know what I was going to do with my life until, 2 months before graduating, actually. So it was a little bit alarming. I learned about medical physics as a career path or as a field. I didn't even fully comprehend what all can be done about it at an undergraduate physics conference in Halifax in like October, and I was finishing in December. For me, the realization that I actually wanted to do medical physics as a career, as opposed to just, I'm going to do a master's and kind of see how it goes, happened probably while I was in my master's and surrounded by other medical physicists and seeing all of the different potential that career could actually bring. Mm-hmm. So I was already in my master's when I thought, this is something I could do. This is something that I'm interested in. What do I need to do this as a career? So
incredible. Mel, I'll throw it to you.
How much research is actually like involved in your day-to-day life? Because I know at least when I'm looking into like physics careers, I think research is kind of a big part of a lot of them. So how much research is in your day-to-day?
Do you want me to go first or do you want to go first?
Yeah, go ahead.
So for me, at the moment, I'm 50% research, 50% clinical. Before I would say 70 to 80% clinical and only 20 to 30% teaching and research. It depends strongly on kind of where you are, what university you're affiliated with, and the environment you're in. There are definitely places where medical physicists are more research oriented and more heavily, have a more heavy academic career with little contribution to the clinic. So it really can vary depending on both your background and, again, the institute and the university with affiliation, if any. So yes.
Is there opportunities to carve out more of a research-based career if that's what you're interested in, or?
I mean, there are opportunities, but you kind of have to pursue that environment that allows for that kind of a career.
Right.
I entered my current career being predominantly clinical, and only recently tried to, get my academics resuscitated.
And I would say, just to jump in, I'm sort of the opposite of that coin, right? So I'm a 100% clinical physicist. There's still expectation to do research, but as I kind of try to show you in my slides, our research is very translational, right? So we work with physicists like Alexandra. They have a different kind of HR stream in the university, where they are the fundamental physics or fundamental medical physics. We are the translational guys. So we'll take something and we will apply it to the clinic. And actually, one of the things I love about it is that you can literally see the next day or the next month that you're using the technology you just developed or the technique you developed on a patient. You're gonna go and publish a manuscript to kind of describe the experience or your study that you kind of came up with. So even though, there's different streams and they can they're very siloed in that aspect, we could still participate in a lot of research that's maybe less kind of intense, or less fundamental to your job, rather than these sort of projects that you can pick up and really involve yourself with.
Well, that also opens this is a nicely, everything tonight has segued so nicely. I have to say, this has been a wonderful easing in and out of questions. We've got a follow-up question in the stream from Elizabeth, who wondered if there was any career opportunities for undergrads. Is there opportunities to intern, to sort of do anything at that level to see if that's what they kind of want to pursue prior to a master's or a PhD?
So often, not so much an intern, but there are definitely opportunities for people to apply for summer positions. For example, the radiation medicine program at Princess Margaret runs a summer program that I think they've actually just posted openings yesterday or this morning. Seriously, it happened.
Well, we can put that information in the in the stream line.
So I've actually had these questions come to me, and what I recommend people do is look at the description of the summer jobs and try and apply for them. And hopefully you get paired up with a more physics related project, and that should give you exposure to what the job actually looks like. And it's much easier than to when you're already have your foot in the door and you're here and say, is it okay if I follow you around for 2 days just to see what your day is like, rather than cold calling a physicist in the clinic and saying, can I come in and follow you around? It's like, no. So I highly recommend people look for those opportunities. They definitely do come up. And same thing, if somebody's not in their final year, but again, co-op, participating in co-op programs and so on and so forth, just to get that exposure to see what it's like to be in this environment.
Well, and we'll make sure. Oh, sorry, go ahead. Go ahead.
I was going to just add one thing. I agree. We always have a summer student in Stanford. At least one summer student running around, kind of working on a project. There's also a kind of a niche position for these physics assistants or associate physicists. I'm not sure what the terminology is back home anymore, but basically it's a kind of a subset of physics duties that are kind of the more routine, the QA, the testing of the machines, running a lot of these kind of routine tests that we can actually kind of, what's the right word of saying it?
Delegate?
Push over, the delegate, that's right, thank you. Over to this secondary role.
Delegate's better than dumping over to somebody else.
Voluntold, I think is what. No, I'm kidding. But it's a really. That's how I started actually. After my master's, I didn't really know what to do, and I found a job temporarily as a physics assistant, and I realized, wow, I really love being in the clinic in this fashion, which allowed me to pursue a residency. But those who don't often require a PhD, even on undergrads, there's definitely positions there. So I think there's opportunity there for many different avenues for people, not just straight medical physics.
Yeah, so I think physics associates is what we have here as well. And yes, definitely more quality assurance, even patient-specific quality assurance. They would be doing this sort of like monthly QA, and they do not require master's or PhD. It's not a temporary job, but it's a full-time job typically. But yes, those opportunities can also arise, and they don't require any graduate training.
Exciting. Well, we've got a question here. Christian Schultz-Nielsen just got out of his lab and he wanted to say hi. And he's also got a follow-up question here. We can use it. I love this new system of being able to pull questions up. It's phenomenal. Christian wanted to know how important is creativity in a clinical setting. That research requires a heavy degree of creativity, but can you give examples where treating a patient's required out-of-the-box thinking?
Well, you should have been here for the presentation. I had the exact example.
I know.
But no, it's a lot. There's a lot of creativity and problem solving that you go through. And it's a lot of the time, it's like the on the spot, there's a patient on the table, things are not working out. The doctor's here and saying, okay, what do you do? And so that creative thinking and on the spot kind of response is really important.
Is that a thing that can actually commonly happen? Like, are you brought into a situation where there's a patient getting treatment and there has to be a decision made and some kind of creative outside the box decision has to be done?
Yeah, so just this morning my phone was blowing up, but we had a patient, so we're treating the patient in like a respiratory fashion. So the machine is watching the patient breathe, and we're only treating at a certain phase of the breathing cycle in order to limit how big of a field we have to be, right? So we're just targeting this little motion of the tumor, we're just shooting it at a certain position of the motion. Well, this patient was planned one way, and on treatment, on the first day, just nothing was working out. This patient's breathing erratically, we don't know what to do. So basically you sit down, with the doctor. You evaluate what, where they were prescribing the radiation. You evaluate what the patient's doing on the treatment. You say, is it a no go or a no go? And ultimately, you play a huge role in that decision to say, well, yeah, I think we're safe or we're not safe. Yeah.
Wow. It's so exciting to see where physics can take you, I think we often tell our students that physics is a degree of learning how to learn and how to improvise and how to come up with things on the fly. And medical physics seems to really be an embodiment of that idea.
I completely agree. Sorry, I was just going to add in terms of, out of the box thinking and creativity, just to add to what Piotr was saying, we've definitely had situations, where an oncologist will come to you and say, well, here's a situation, here's a patient, this is the, extent of the disease, and so I'm in brachy, so none of the applicators we currently have are going to do the job. There's nothing on the market, or is there something on the market? Is there anything that we can do? This patient's coming next week. So, we've definitely had colleagues that would basically, we would, in the machine shop with some 3D printing would create something that, would be modified, that would work with existing equipment in order to kind of get a distribution internally that we would desire when something is just not available. And sometimes you have to weigh, in the situations like that, weigh the risk of inventing on the spot against actually, treating the patient if perhaps no other options exist. And that, especially in brachytherapy, comes up, the idea that, well, if we can get a needle in there, we can probably treat just about anything, is often how it's viewed. So definitely, it's a thing.
Amazing. And Piotr, I guess we have to meet your cat. Is it named Schrodinger or Irwin or Dinger or Irwi?
It's Felonious. It's like Felonious Monk. My wife's a musician, so it's Felonious Monk. Yeah.
Yes, we're aware. Fantastic. Well, hold the cat up. Let's see. Very fun. Fantastic. Exciting stuff. Well, I think we're reaching the hour mark. We should probably move towards wrapping it up. Do either of you have any closing statements that you want to make, or anything you want to impart to any of our viewers that you don't think we hit on so far?
No, the only thing I can that I can say to people is, to pursue a degree or a topic that you are passionate about. And at the end of the day, again, these rules are constantly changing. But at the end of the day, if medical physics career is something that the person wants to pursue, there are definitely, routes that can still potentially be taken. Again, easier with a PhD at the moment, just the way things have been going. But I think it's really important to just do what it is that resonates with you and what it is that gets you excited to wake up every morning. And the rest should fall into place.
Yeah, that's really well put. And I would add that I think people can pick up on passion. And if you are passionate about what you do, it doesn't really matter where you came from or, what your background is. Really, being able to communicate, being able to be passionate about how you approach things, I think is a huge benefit to this kind of field. And I think as an undergrad, if you are interested in medical physics, just give us a call. We're very friendly, we're very open, we're a very small community. There's not that many of us, and so chances are that you'll get somebody on the line and we can chat your ear off about what we do and how to do it. And probably before COVID was a better time to come visit a clinic. Now nobody goes in anywhere, but there is a lot of opportunities. If you just reach out and kind of make that initiative, you can really get a good sense of what this field is and what opportunities there are.
Well, that segues nicely yet again into plugs. Is there ways people can follow your research, or if they want to get directly into communication with you, is there a way that they can reach out?
Definitely. I don't know that I've included my email on the presentation, but I think I'm Googleable. So my email can be easily found.
You don't have to give it out if you don't want to.
No. It's public information. So I can be found either Department of Radiation Oncology at U of T or the Medical Biophysics Department at U of T. So my contact information is there. And yeah, if people have any questions, definitely feel free to drop me an email.
Fantastic.
Likewise. Yeah, doors always open. Yeah, just give again, Googleable is a good term. And yeah, like I said, don't be shy. I mean, we're always happy to help and share our knowledge and our experiences.
It's your last chance to give out your address if you want to.
Can I put it in the comment section?
There we go. All right, and I guess we'll get Mel to lock in with her closing question here.
So I think this is a good way to close. What has been your most exciting day as a medical physicist?
That's so I do have one exciting day that I can think of that absolutely I think revitalized me. As I've mentioned, I spent majority of the beginning of my career being mostly clinical. I also, took several mat leaves, and I wasn't sure if I would be able to pursue an academic career after kind of this, multiple year hiatus. And in order to see if I could, I applied for a grant. And the day I got that email, I think, frankly, was the most exciting day of my career, because it reinforced reinforced my passion again for the research that I've kind of put on hold for so many years, and gave me the confidence to say, you know what, I know I haven't been doing this for a while, but I can clearly do this, and here's evidence of it, and to kind of start again. So that was really, really, I don't want to call it life-changing, but that was really important for me. It was really exciting.
For me, I would say, so I had the rare opportunity to, right out of residency, I was hired to start a new cancer clinic, and it was just from the ground up. I got to play a role in designing the rooms, to choosing the machines, evaluating the shielding. And so part of that process is when the machines get put in, as part of the physicist's role, is you sit there and you characterize the beam and make sure that it's safe. And you then take that beam data that you've got, you put it into a computer, you crunch out all these algorithms in order to model the way that the radiation is deposited in the patient, so that the people can then use all these tools. And after, this can take several months to 6 months, let's say. So all that work that you've been putting in, you're doing all that work, and calibrating everything, and then there is a day that you look at this machine that you've been staring at with cables everywhere, and now there's a patient there, and there's therapists that are now using this machine to shoot deadly radiation at this patient. You have this moment of wow, it is a very culminating moment of achievement, and also this I remember, did I triple check everything? And it was really something to experience that, and I got to experience it once in Canada, and again here with starting this cancer center in South Bay for Stanford. And it's really one of the most rewarding things, to put all this work into something and then see it go live for not just yourself or it's one patient, but an entire cancer center or at least radiation oncology department. It's really, really rewarding.
Fantastic. Well, thank you so much. We'll say goodbye to you after the stream, so don't hang up, stick around, but I'm going to sign off. I wanted to thank our guests tonight, Dr. Alexandra Rink and Piotr Dubrowski. I also would like to thank Mel for joining us as our reporter on the ground. And as always, I'd like to thank very much our producer behind the scenes, Saksham Sharma, for making this all work and for making this watchable. Thank you very much, everybody, for tuning in this week. And please continue to subscribe to our YouTube page, as well as join the Facebook group. We're at Guelph Physics on all platforms, Instagram included. We're going to continue to be doing these streams as often as we can. I think people seem to enjoy them. So if you have any suggestions or things that you'd want to see us do a live stream about, please feel free to just mention it in the comments. But other than that, thank you so much, and take care, everybody. Stay safe out there, and have a science-tastic day.